Let's bring in Dr. Roger Crystal tonight. He's a former surgeon and the inventor of Narcan Nasal Spray. It's used to prevent and counteract overdosing. He's also the CEO of Opiant Pharmaceuticals. Dr. Crystal, thank you for being here. This no longer seems to me an epidemic that fits neatly into these old categories, like someone either took heroin or they took oxycodone. Something like 8 out of 10 deaths now are related to synthetics, things like fentanyl. What's happening?
Yes, unfortunately, it's all rolled up to fentanyl. So fentanyl is an opioid, which is 50 times stronger than heroin and therefore also OxyContin and other such medications. And we've seen the opioid crisis really now be better termed a fentanyl crisis because of that.
This opioid epidemic has gotten just more deadly over the last year, which didn't even seem possible. It doesn't matter if you're a blue-collar family, white-collar family. It doesn't matter how much money you have. When we come to thinking about how do we solve this really deadly and scary crisis we're in, medication-assisted treatment seems to be the most effective, not just pure abstinence. But a lot of people don't like that idea. Why aren't we seeing more of that?
Absolutely. I think the role for medication-assisted treatment is paramount. In fact, the term in itself is somewhat unhelpful because it implies it's an adjunct form of treatment, whereas it should be the mainstay. The best data out there, the most scientifically appropriate approach is to use medication to treat people with what is a chronic brain disease. In the same way, another chronic brain disease such as multiple sclerosis requires medication, and with that, although we can't cure this disease, you can prevent relapse and promote longer-term recovery. And that's the same with opioid use disorder, or in fact, all chronic addictions.
I understand you're creating a fast-acting medicine for synthetics like fentanyl overdoses, which now are the majority of deaths in the country. Medicines like Narcan, which you invented, they can save lives. That is clear. During an overdose, they bring someone back. But some communities have said, we're not going to go that route because it doesn't fix the underlying problem. It actually becomes a crutch for these people to do again and again and again. What do you say to that?
There's 2 or 3 considerations here. Firstly, I just think that from a moral standpoint, it's inappropriate for us to judge people's behaviors which are driven by an underlying disease. Second, if someone overdoses and dies, then there's no opportunity for that patient to undergo chronic treatment of their chronic disease and therefore benefit from longer-term recovery. So those are the 2 things that immediately spring to mind. And in the same way, for people with lung cancer who receive very expensive medical treatment, even though they may still smoke, I think that's a similar parallel that people fail to appreciate.
And something we know to be true as a public health matter, as a policy matter, there's one thing. If it's someone you know and love personally, it seems to be, go to the ends of the earth. Final question here. Bottom line at this point, we knew the villain, if you can call him that, of the last wave of the opioid crisis, the pharmaceutical companies lying about their products, getting people hooked and seeing this ripple effect. Now we kind of know the state of play, but who's to blame for the newer, deadlier wave?
When we talk about blame, I think it goes back to the important understanding of a chronic disease at play. And in terms of who's to blame, there's several stakeholders at play. And in terms of, even if I made it illegal now to prescribe any more opioids forevermore, then I still have millions of people with opioid use disorder constantly craving, constantly needing a fix because of the dependency that's going on inside their body. So when we think about who's to blame, we can try and do that, but what we need to think about is going forward, how do we change the system to allow 2 things? Number 1, those people with opioid use disorder to get the best possible medical treatment to reduce the frequency and severity of relapse. Second, we need to do everything we can to prevent the funnel continuing to grow, meaning more people becoming dependent on opioids, becoming dependent on alcohol or other substances as well.
When so many people feel desperate and overwhelmed, they think, gosh, I'm just going to give up. You've been in this fight for a long time. and it sounds like you're in it for good. Dr. Roger Crystal, thank you.
Thank you.
And if you or someone you love is struggling with addiction tonight, help is available right this very moment. Take a look at drugabuse.gov, or you can call the number that we're going to share on the screen. Both are a great place to start. Just a tiny piece of hope. It's a really powerful thing. A lot still